Hope you're good.
Pretty good. And you?
Very well, thank you. Tell me.
Cholera.
Cholera, fantastic. One clap for him. And so today I'm here to talk to you about cholera and its prevention. So are you ready to learn?
Yeah.
Okay. Now listen. Cholera is an acute diarrheal illness caused by infection of the intestine. It is caused by what?
Infection of the intestine.
By the infection of the intestine. You know, we have the small intestine and the large intestine. Now, it means it's a very serious stools as well as what? Vomiting. That's what diarrhea is. But when it is very serious and when it is very chronic, it is called what? Cholera. So imagine someone stooling. The person, there's poo coming out. That's diarrhea. And when it is so serious, it is called what? Cholera. And it's caused by an infection. And it's a type of bacteria that causes cholera called the bacterium vibrio cholerae. It can cause severe diarrhea and dehydration, which can be life-threatening if not treated properly. How is it transmitted? That is, how can one get cholera? Cholera is typically transmitted through the ingestion of contaminated water or food. During our portfolio, some of you had a presentation on bad water, right? I remember Ife doing that presentation, bad water. Some of you contaminated food. Water that is not fit for drinking or food that is not fit for what? Eating. And it is often spread in areas with inadequate water treatment, poor sanitation, and insufficient hygiene. So one would tell you wash your hands when you go to the restroom, after you urinate, or when you defecate, or you step outside, always wash your hands. Make sure you stay in a clean environment. Now, can cholera spread from person to person?
Yeah.
Cholera is not typically spread from person to person. It is primarily spread through contaminated water and food. It is primarily spread through what? Contaminated water and food. However, close contact with an infected person, when you have close contact with an infected person, there's a risk of what? Having what? Cholera. Now, what are the symptoms? What are symptoms? You can tell me. Symptoms means what?
Effects.
What? Effects. Yes. Yes. Signs. Thank you. Signs of cholera. Now we have severe watery diarrhea. Did you hear that? Very severe. Chronic. Watery diarrhea. Watery. When the poo is so watery and you're defecating and it's splashing around the toilet seat. Right? Vomiting and leg cramps. When you're feeling, some cramps in here, in those joints and all, you're feeling pains and all. In severe cases, the infected person will experience rapid loss of body fluids, leading to dehydration and shock. And without treatment, death can occur within hours. Say, I will not die.
I will not die.
Yes, we will not die in Jesus' name.
Amen.
So how often those symptoms appear after infection? It can appear anywhere a few hours to 5 days. The symptoms can show within a few hours or 5 days, but it's usually within 2 to 3 days. Who is at risk of contracting cholera? Who are those that can contract cholera? Listen, people living in or traveling to areas with inadequate water treatment. Make sure the water you take is pure and treated. Right? People that have what? Poor sanitation and insufficient hygiene. Right? So please make sure you drink water often. You see me at times, I'll come to your classes, I'll see some bottles that have not been touched at all. You need to drink water, stay hydrated, because water helps to flush your what? System. And you do that through sweating or urinating. So make sure you drink water often, maintain proper hygiene, washing of hands, sanitizers, dress well, neat clothes, you wash your plates, your spoons, utensils, your environment, your bedrooms, your pillowcases, your mattresses, the bed spreads and all, everything must be neat. Now, how do we now prevent this? How do we prevent cholera? By drinking and using safe water, either boiled, treated, or bottled. Practicing good sanitation and hygiene